mHealth is here to stay. And the reason I say that, if you look at healthcare challenges, all of us know about the challenges that we face in India. Whether you talk about patient to practitioner ratio, when you talk about hospital beds to patient, population ratio, we are the lowest in the world. But we have a huge advantage. The biggest advantage is that India is poised to be the third largest smartphone user market in the world. Now, that's where mHealth can play a big role. If you see what has been happening, every day you pick up a newspaper, there's a new startup announced in this area. So right now, what it has been doing is practice management. So connecting patients to doctors, right? What we bring to the table is a shade above that. It's not only practice management, but clinical decision support system to improve the outcome for the patient. Now, it has a huge relevance in India. If you look at, 70% of our population lives in the rural area who do not have access to quality healthcare, not access to medical personnel. mHealth is set to change that, but not only from practice management side, but from the clinical decision support standpoint. And one of the products that I would like to highlight is this product called UpToDate, which you can have it on your smartphone, and it can give you a clinical evidence-based answer to any question that the doctor has, right? And this would be validated by medical journals that have been published till yesterday. And by the way, this can even work without internet connection. So it's very much ideally suited for the infrastructure that we have in the country and the need of the country. So for me, mHealth is here to stay, but coupled with clinical decision support system, it can really be advantageous to the fullest. mHealth is evolving in a really great fashion, and in fact, is here to stay. The reason I say that, all of us know the challenges that we have in India. We have, if you look at practitioner to the patient, we have one of the lowest ratios. If you look at hospital beds to the population, we have one of the lowest. But the big advantage we have, India is poised to be the third largest smartphone user in the world. And that offers the great opportunity to take mHealth to the next level from the standpoint of healthcare. So mHealth, if you see what is happening today, is more about connecting patients to doctor. So it's more about workflow management. However, the real proof of the pudding would be when it is supported with clinical decision support system. I'll give you one case study that has been done in NHS UK, where they concluded that a hospital which spent anything that they spent on mHealth with clinical decision support system, they were able to recover within 90 days the investment. So I see a huge opportunity for the Indian hospital to translate the same thing and have a much better ROI using mHealth, but coupled with clinical decision support system. If you look at mHealth, it can be divided into two parts. The first part is improving the patient care gateway. And we have a great offering called UpToDate there. Now, just to give you a brief about what this product is. So this product is in use globally for the last 20 years. More than 850,000 doctors around the world are using it. Some of the countries like Jordan, Spain have actually taken it as a resource for their whole country. In US, 70% of the doctors are using it. So it's a really researched and clinical evidence-based product. Now, the USP of this product is that not only is it evidence-based and research, but also it is downloadable on a mobile. And it can work without any internet connection also. The answers that it gives, 95% confidence level, you can say that a physician will be able to get an answer to the question that he faces. Now, the reason it is important is research has proven that in a typical day, the clinician faces 12 questions that he needs answers to. 60% of them remain unanswered. If the answers are given to this 12 questions, 5 to 8 patients will be affected positively about this. And in fact, there is a case study which was done on this particular product in Harvard, where they said that they researched over 3,000 hospitals over 3 years, and they concluded that the hospitals which were using this tool saved 11,000 more lives than the hospitals which were not using it. There was again a study done in Singapore National University Hospital, which concluded that doctors, when they used on the bedside treating the patient, they changed their decision 37% of the time when they used this tool. So this is a great offering that we have from the patient care gateway pathway. We do have an offering in improving the infrastructure of the healthcare system, which is called a POC advisor. That is also can really help in India from mHealth standpoint. Like I said, we do have challenges in India. The biggest challenge I would say is that 70% of our population lives in rural areas and they do not have a good quality access for healthcare. Now, this tool can really help to change. The tool that I talked about, UpToDate, with this being available on a mobile, being able to work without even internet, it can be really a boon to people or the doctors who are sitting in PHCs, who are MBBS, but they can have really clinical evidence-based treatment quality to the rural population. So I see that a huge advantage, which will help in the public healthcare improvement. On the private side, like I said, 70% of the US doctors are subscribing. We've just started in India and already we have more than 10,000 customers who are using it. We did a survey just last year and 95% of them said that they really found this tool to be useful in improving the patient outcome. So I see a huge opportunity both on the public side and also on the private side. So, there are multiple hospitals which have been using UpToDate. If you talk of AIMS, PGI, CMC Vellore, they have been using it very successfully. If you talk of private hospitals, Manipal, Columbia Asia, they have been using, chains have been using. The one that I would like to highlight is Mahatma Gandhi Institute of Medical Sciences in Varda. If you go to that hospital, just seeing is believing. All their operations is on a tablet. And especially, since it's a teaching institute, the students who are learning postgraduate sciences, they use UpToDate as a standard. Any decisions which are being made on the bedside with the patient are clinical evidence based. So I say that is a great example for being used in India, apart from all the big names using it today. POC advisor, full form is point of care advisor, and it's something new that we are working on. It has been launched in US. Just to give you a simple example, sepsis is a medical term. If a layman term, it's poisoning of the blood. It's a life-threatening condition. However, if you catch it at the right time, an intervention by the medical, either nurse or a doctor is made, the life can be saved. Now, what we had done with the case study on this POC advisor in John Muir Hospital in US was that we had the wards divided into two parts. So we had some wards that we gave POC advisor, right? And some wards we did not. The results were remarkable in the randomized clinical research. 50% more lives were saved in the wards which were using POC advisor. And the way it works is very simple. It resides in the electronic healthcare record system of the hospital. And as soon as an indication of some kind of a data of a blood poisoning happens, it's immediately transmitted to the nurse and the doctor, and the treatment is effected. And that's what led to these remarkable medical results. Like I said, we have still not launched it in India. It's in works in the US, and we've really, I think it's the next level of UpToDate, what I just talked about. We do have an offer in the offering, like in the next 1 month, we'll be launching again something called UpToDate Mobi Complete. So, I talked about the hospital in Varda, I talked about AIMS, I talked about all these hospitals are using UpToDate, but this UpToDate resides in one computer in the library of that hospital. Now you can imagine still they're using it and they're really liking it. However, with this Mobi Complete, I'll be able to provide to all the doctors and even nurses on their smartphone the power of the evidence based on their, right at the tip. And the product has a guarantee that 95% of the time, any question you ask, 90 seconds you can get that answer. So I think that's really powerful, and we'll be launching in the next 1 month or so this product in the Indian market also. I'm really optimistic. Like I said, the base case of having a smartphone user, which is third largest in the world, is really exciting because, as you can imagine, for M Health, this mobile communication becomes the base, right? So we have a very strong fundamental there. And we have gone to the practice management state in health, and we are making good inroads in clinical evidence based in ML. So I'm really hopeful that it can really take off in a big way. For sure, it is here to stay, and we can really realize the fullest power of it when we club mHealth with clinical decision support system.